Okay, hey Jonathan.
Hey.
Okay, so what can we do for you today?
So I've been climbing recently and been working on some new things. I think I just pulled one of my muscles a little too tight right over here.
Okay.
It just feels a little sore. But figuring that, you know, a quick little twerk will get that going perfect again.
Okay, so let's do it. Before you do, hey, will you stand up and bend for me? Just show me right where the
Sure.
pain is.
So it feels like it's coming from here
Okay.
and just moves down a little bit. But the big part is it comes from here and also goes straight up.
Really back. Okay. And is it sore or it's like really painful or
I
just
would-
like tight?
I would almost put it as tight soreness.
Okay. Well, I think we can take care of this. You've got back pain that's coming along this erector spinae muscle down into the hip and then down the side of the leg today, right?
Mm-hmm.
Okay, so I just want to test something. I want to check something on your hips. Is that
Sure.
all right?
Sure.
All right, so I'm just going to feel right on the inside of your hip, and I'm going to press. Is this a little sore?
It's a bit, yeah,
It's a
that's
little-
tender.
Right, tender. Yeah, right
And
there.
I feel like a little higher too is really tender.
Right up in here?
Yeah.
Yeah, okay, let's check the other side. Here.
Not as bad as the right side,
This one's not as bad as the right side.
but definitely tender.
Definitely
The
tender.
right side is the worst, though.
But this is the worst.
Yes.
Okay. What's happening is this is the psoas muscle I'm feeling. It's a thin muscle that starts on the inside of this hip and goes to the spine. And the reason it's so tender is because it's spasmed and shortened. And then when that happens, it's usually a sign there's another muscle called the quadratus lumborum in the back that also is, it's kind of turned off. It's like not working. And when that's the case, on the opposite side you feel here, it's going to be really tender under the 12th rib, like right up there.
Yeah, wow, that's exactly right.
Right, but this side will be a little better, right?
Yeah, that's the right side is tender, but not as bad as the left.
All right, okay,
That's
so
really cool.
so that's the classic pattern. Okay, so we'll just start treating it, and then we can talk about kind of what's causing this and see how we can prevent it in the future. Sounds good?
Yeah, definitely.
Okay, so we're just going to do a little acupuncture. I'm going to do just 2 points on the legs, and we'll see how that does, if this opens up, and if we need to do more, we'll do more.
Okay, perfect.
Okay, so these are the acupuncture needles. They are extremely tiny, extremely gentle, shouldn't hurt. If you feel, what you will probably feel is some sensation of heaviness or tingling, or it could be a feeling of kind of achiness at the point, because it's stimulating the nerves to make changes in the body. All right.
Alrighty.
So the first point, that's kind of the classic correction for this, should be very sore on the leg. It's right about here.
Yeah.
Right there.
Wow.
That's the spot.
Yeah, that's
Okay.
that's very
And
sore.
above, it's not so sore.
Not as much, but that spot
And below, it's not so sore.
not as much.
All right, but that's the spot. All right, so
Yeah.
we're gonna go in, and it's gonna feel a little achy. 1, 2, 3. And did that hurt?
Nope, not at all.
All right, and now how's this? Feel a little ache?
A little bit, yeah. Yeah, now I do.
Perfect. Okay. And then the other side, it's gonna get a partner. Let's see, and that's going to be right here. And this one shouldn't be so achy. You're gonna 1, 2, 3. There you go. Did that hurt?
Nope.
Nothing.
Feels good, actually.
Excellent. All right, you feel a little bit of pressure or heaviness or tingling here?
Slightly.
Slightly. Okay, perfect. So now we did these two. We're going to kind of recheck this hip. How's this feeling?
A little less tender, definitely.
Little
Feeling
less
like
tender.
something's opening up.
A little less tender. Okay, got it. And then this one?
Yeah, feels.
That feels a lot better.
Yeah, it feels a lot
Okay,
better.
but this one's still a little tight.
Mm-hmm.
We'll check this right here. How's that?
Yeah, I don't feel
That
it.
one's better. Okay, so that's pretty good. But this one still has a little more to do.
Yeah, like right where you're touching, like right here.
Okay, so this one's right here on the, so it's really not on the inside of the hip, it's on the outside of the hip here that you're feeling the main pain now. Okay, so that's a little bit different. We're gonna actually do a point right here. This wasn't the plan when
Alright, sure.
we first started, but let's do a point that's in your arm. We're gonna just roll this up. Yeah, thank you, buddy. Okay, and let's see. Right, it's a little tender right in there.
Yeah, I think a little to the right.
A little to the right, right here.
Yeah.
That's the spot. Okay, 1, 2, 3. And you feel it?
Mm-hmm.
Perfect. All right, so let's retest this. How's that doing?
Pretty good.
Yeah, very quick. Okay, great. So, yeah, that should be a pretty
Yeah,
decent...
I feel the blood flow. I feel like tingly here now.
Okay, excellent. So now before I go, I just kind of want to talk about like why this is happening.
Sure.
So there's 2 types of back pain in Chinese medicine. There's it's called excess pain and deficient pain.
Mm-hmm.
So with excess pain, it means that stuff is kind of like stuck up in here. The blood is not moving, it's swollen, nothing's kind of getting through, and that's what's kind of causing that pain, the lack of movement.
Yeah, that's exactly what it seems like.
Right. So that is very good to treat with massage. It's very good to treat with trigger point acupuncture, this kind of thing. But I think that actually you don't have. I don't think you have the excess type. I think you have the deficient type.
Oh.
Yeah, and the reason why is based on taking your tongue and pulse, because the pulse, when you feel it, for someone who has excess pain, usually. It's going to be a very forceful, strong pulse, and yours is more soft and gentle. And then also, when I looked at your tongue earlier, like I saw that it's a little bit pale and a little bit quivering, which says the body doesn't have like so much strength. You've been like working very hard. Maybe not sleeping so much.
Yeah, definitely not.
So when that happens, the body tries to preserve energy, and it takes a lot of energy to get the person to stand up straight. So what can happen is the some of the strength that goes to the muscles kind of shuts off, and some of the muscles shut down, like that quadratus lumborum we talked about. And then what happens is the other muscles, they tighten up and stiffen like rods in order to kind of keep the frame of a person. And so that's what was happening with that tight psoas. It was stiffening to kind of keep your frame. But in doing so, it was pulling your hip kind of upwards and pulling your spine to the side and causing that pain. So this acupuncture correction we did was really just to strengthen the deficiency, to like boost kind of your general energy, and specifically these points boost the energy that goes to the low back.
Oh, excellent, excellent. Yeah, it's kind of like when we did the multivities muscles.
Yeah, the multivities.
Those tightening up, kind of like the same situation that we had with that, right?
So that was actually a trigger point therapy release, which was for an acute excess type pain that day. But now you're coming with kind of deficient things. So this should really kind of gently clear it up by strengthening the muscles. Like this one no longer needs to work so hard, and so really immediately it feels much better, right?
No, definitely. I even feel it through my legs as well, where I could feel blood flowing to my big toe on my right leg that I didn't feel like was happening before.
Okay, well, great. So I'll step out, turn out the lights, and we'll let you rest for about 20 minutes, and I'll come check on you in the middle.
All right.
And then we'll do some cupping on the back.
All right, sounds good. Thank you.
Okay, so I'll see you a little later. Jonathan?
Hey.
How you feeling?
Definitely a lot better, thank you.
Okay, good. So let me just check these hips.
All right.
Feels good?
Yeah, definitely. There's pretty much no tenderness at all. Definitely feels good.
This side?
Definitely feels opened up a lot more.
Okay, and what about over here?
Don't even feel it.
Okay, so
yeah.
Job well done.
Yeah,
definitely. So I'm going to turn the lights. We're going to take out these
Okay,
points.
perfect.
There you go. Sorry, a little bright.
No worries.
And let's see, and then how about we flip you over, and we'll do a little cupping just to get some myofascial release.
Okay, perfect.
Yeah, because I know your whole back tends to get tight from all that rock climbing.
Yeah, definitely tightens itself up.
Okay, so let's just feel what's going on. Sorry, my hands are a little cold. Let's see.
Yeah, right
there. Yeah, right there. See, that needs a little love. Okay.
Yeah, that's expressing the lower back's pretty good.
Right, that's what we just worked on.
Yeah.
But now we've got some of that kind of excess stuff we talked about. Yeah. Work on. Okay, great. So I'm just gonna put a little bit of massage salve on you, and so these cups can move when we do it.
Sure.
There we go. Going up here. So the way the cups work is they're glass suction cups, and the way they suck is I put a cotton ball that is lit on fire in the bottom in order to draw the oxygen up, and that will cause them to, that will make it stick to your back. So I'm going to come in and do 1, 2, 3. There you go. A little stronger. How's that feel?
Pretty good.
Okay. And 1, 2, 3 on the other side. How's that?
A little stronger.
There you go.
There we go.
Perfect. Okay. And so we're just going to move it up and down a little. How's that feeling?
Really good.
Right. And so this is really nice because a massage pushes, but this pulls. And in doing so, it really loosens the fascia in a different way. It also can draw up stagnant blood and toxins if anything is kind of stuck up in there, which is like we talked about earlier with that excess and deficiency. So sometimes it can leave a mark. Looks like you got attacked by an octopus. But the interesting thing is you do this 2 or 3 times, that mark will then not start coming back because you will have cleared a lot of the stagnant blood and some of the toxins that are hanging out there. How's this feeling?
This feels really good.
Really
I
good.
could do this all day.
So there we go. We're opening you up, getting things moving. Perfect. And we're gonna, I think, just hang out right here, which is that area where you felt a lot of tension.
Mm-hmm.
And so, give that a minute. Okay. Feels good?
Really good, yeah.
So this is a technique called the dragon roll, which is from Tui Na, which is Chinese medical massage. It uses vibration to open up the muscles. And so, unlike a lot of pushing techniques, it opens things up without being painful.
Yeah, this doesn't hurt, but I could feel a lot more blood flowing to my lower body right now.
And you have one right here, and one right here. There you go. So with his neck a little. And I think you said you had a little tenderness on the right side of the neck?
Mm-hmm.
Okay, and then right about here? Right here?
Yeah, right there.
Right there, okay. So I think we'll address that next time with the acupuncture.
Sure.
Actually, yeah, we'll do it next time. Okay, and now one more level, and we're going to do a little bit of the flash cupping technique on the bottom, and that's going to loosen it while keeping the kind of strength in there, and not just kind of draining and opening things up too much.
All right. But yeah, my upper back already feels so much better.
Good, good. Okay, super. So, take this off. Here. So this one, we're just gonna put it on and off, on and off. How's that feel?
Pretty cool.
Yeah, sounds cool. Okay. Before we get up, just one time, get everything, and then how's that feeling?
A lot looser, definitely.
Okay. Excellent. All right. So we're good to go.
All right. Awesome.